Welcome to Lab 3, Muscles of the Shoulder Girdle and Arm. So we are in the 3D real-time shoulder and arm section of Primal Pictures. And we're gonna start by adding, let's go to shoulder muscles. That looks good. We'll zoom out a little bit. Okay. Let's get rid of some of the things that we're not going to be talking about today, just so we have a nice clear view. So I'm going to be jumping around a little bit around your lab outline, just because it'll make a bit more sense depending where we are. But we'll start right at the beginning with trapezius. So when you go into this section, the skull won't automatically be here, but let's add it to give you a little bit of reference. Okay, so you can see your trapezius with its sort of notable triangular shape attaching to the occipital bone, okay, and then down the ligamentum nuchae and all of the spinous processes of the thoracic vertebrae. And then we can see the insertion being somewhat of a horseshoe shape. Let's get rid of that. So you can see it's attaching here on the lateral third of the clavicle, and then here on the acromion, if we follow it around, along the spine of the scapula, okay? So it's kind of a horseshoe shape. And when we get to deltoid, you'll see that the insertion of deltoid matches the origin of deltoid matches the insertion of trapezius. Well, let's do deltoid, I guess, since we're here. So we said that the origin will be the same as the insertion of trapezius. So lateral third of the clavicle, acromion, spine of the scapula. It's going to come down and insert on this little raised area on the lateral surface of the humerus called the deltoid tuberosity. Let's line back up. All right, let's move posteriorly. Okay, we're going to remove trapezius. So we've reflected trapezius, and now we're looking at structures that are immediately deep to it. So we'll begin here. So let's get a little orientation to where we are. So here's our scapula, okay, the medial border of the scapula, and this is the spine of the scapula here, okay? So attaching right near the superior aspect of the medial border of the scapula is levator scapulae. So you can see that it has 4 segments that converge to attach on the medial border of the spine of the scapula. Okay, and your origins, let's spin around here, will be here on the transverse processes of C1, C2, C3, C4. All right, as we move a little more posterior, we have our rhomboids. So rhomboid minor and rhomboid major. You do not have to write the full Latin version, rhomboideus, like that on a test. Just rhomboid major and rhomboid minor are sufficient. So you'll notice both are inserting on the medial border of the scapula. Okay, so rhomboid major is inserting below the spine, so the more inferior aspect of the medial border. Rhomboid minor is inserting right at the level of the spine of the scapula. And your rhomboid minor is more superior, okay? So it's originating on the spinous processes of C7 and T1. And then rhomboid major would be T2 to T5. All right, let's go next. Let's go right here. Latissimus dorsi. And this is your first of many reminders that when you're writing fill in the blank or short answers on a test, be sure that you are writing out the full name of a structure. So what I mean by that is you have to write latissimus dorsi, there's your spelling. You cannot write lats, okay? You're not getting half marks for lats, you are getting 0 marks. We need to see that you know the full name, okay? So latissimus dorsi, very, very broad origin. Okay, starting at T7, running along the spinous processes of the thoracic and lumbar vertebrae and the sacrum, okay? And then even over here, oh, we're missing a bone. Let's add that one in. Pelvic girdle, okay, even along the iliac crest here. See that? Okay, so very, very broad origin. So everywhere you see the white, that's part of the fascia that makes up the origin of the muscle, okay? And then what it's gonna do is converge into a very, very tiny insertion. That's my kid screaming in the background. A very, very tiny insertion on the humerus. So let's have a look. So what we'll do, there we go. Let's zoom in a little. So if you didn't see it, I chose context at the bottom. So that removed a lot of things that were blocking our view. So latissimus dorsi is running under the armpit and inserting there on the floor of the bicipital groove or the intertubercular groove of the humerus. And what I want you to show you here, what I want you to also see here is this guy, pectoralis major, which we may as well talk about right now, is going to insert just lateral to the latissimus dorsi insertion. So it's inserting on the lateral lip of the bicipital groove of the humerus, okay? And then latissimus dorsi inserts on the floor of the bicipital groove of the humerus, okay? So latissimus dorsi is a very large, strong muscle with a very tiny insertion, so it's able to exert quite a powerful amount of force on the upper limb. All right. Let's go back to, now we're missing a lot of muscles, so let's put them all back on there. Okay, so where are we headed next? Let's do pectoralis major since we're there anyway. All right, so here's our pectoralis major, and you can see very broad origin along the clavicle and the sternum, and then coming in to insert exactly where we just said, okay, lateral lip of the bicipital groove of the humerus. Okay, there are two heads of pectoralis major. And this is probably a good time to say, again, there's a text button here if you want to bring up the origins, insertions, actions, nerve innervations over here. However, keep in mind that there might be tiny differences between what it says here and what it says in class, and probably what it says in the textbook. Every anatomy resource has very small differences just in how they describe attachments. So please stick to the way that we say it in class. For the most part, we've made it as clear and simplified as possible in class. And we've based it on what the average person has, because as you're going to see in our next muscle, there are some differences person to person. So basically what we've given you in class is what the average person would have versus something anomalous. All right, so that's your pectoralis major. Let's remove it. And deep to that is your pectoralis minor, okay? So this is the one of the ones that I was saying can have some anomalies. This one it quite commonly has anomalies actually. So origin tends to be ribs 3, 4, 5. Okay, here you can see they also have it originating on rib 2. However, when you look at the origin here, ribs 3 to 5. So ribs 3 to 5 is certainly the more common. And then insertion is here. Let's zoom in a bit on the coracoid process of the scapula, which is this guy right here. Now you'll notice in this image, they are showing you that there can be anomalies where you have a piece of pectoralis minor that goes up towards the acromion process. However, that's not typical. Okay, so coracoid process of the scapula will be your typical insertion. Okay, so I think we are going to go to the rotator cuff now. Perfect. All right, so let's take a look at the rotator cuff. So this is a posterior view, okay? Oh, there we go. So let's start at the top. So supraspinatus, originating on the supraspinous fossa. So here's the spine of the scapula and the acromion for reference. And what you'll notice is that the tendon of supraspinatus actually goes under the acromion in this very tight little space to insert on the greater tubercle of the humerus. And this tiny, teeny space is why a lot of athletes who do a lot of overhead motions tend to get problems with in their rotator cuff region. Very, very common for baseball players, swimmers. This is a big swimming injury to have a lot of rubbing and damage and inflammation on the supraspinatus in this area. All right, next up is infraspinatus. So that's originating on the infraspinous fossa and inserting on the greater tubercle of the humerus. And then just deep to that, you have teres minor, and I'm gonna hide teres major for a second. So teres minor originating along the lateral border of the scapula and inserting more inferior to the other two, but still on the greater tubercle of the humerus. And we'll put our teres major back. As a reminder, teres major, not a part of the rotator cuff, but it is located here, so we're still gonna talk about it. Okay, it's going to originate on the inferior border of the scapula, and just like latissimus dorsi, it's gonna wrap underneath and attach to the medial lip of the bicipital groove of the humerus. Okay, so for reference, I'm going to see if I can add pectoralis major and latissimus dorsi. Oh, there it is. There we go. Okay, so then we'll tilt like this. All right, so your bicipital groove is going to be this area here on the humerus. So you have teres major inserting on the medial lip of the bicipital groove, then latissimus dorsi inserting on the floor of the bicipital groove, and then pectoralis major inserting on the lateral lip of the bicipital groove. Okay? All right, let's get that guy out of here. So we have one last muscle to discuss for the rotator cuff, and that is subscapularis. So now we're looking at the anterior, okay? So this is the anterior. There's your first rib, there's your clavicle. So we're looking at the front, okay? So here's teres major, sort of coming around to the front, under the armpit. And this is subscapularis. So subscapularis is originating on the subscapular fossa and inserting on the lesser tubercle of the humerus, okay? Whereas the rest of the rotator cuff was coming from the back and was over here, okay? All right, we're going to move into muscles of the arm. There we go. And again, let's get rid of all this stuff we don't need in the way. There we go. Okay, so we already talked about deltoid. So let's get rid of that. And pectoralis major, bye-bye. All right, so let's talk about muscles of the arm. And as a reminder, when we talk about the arm, we're talking about the area from the shoulder to the elbow, okay? If you're talking about shoulder to hand, that's the upper limb, okay? So shoulder to elbow is your arm. So let's start with biceps brachii. We're gonna need multiple highlights here. Okay, so there's the entirety of biceps brachii. And let's start with the short head of biceps brachii. So the short head is originating here on the coracoid process of the scapula. It's going to join together with the long head of biceps brachii to form the tendon of biceps brachii. And that's going to come down. Let's get rid of a few things here. There we go. That's going to go down and insert on the radial tuberosity down here. There we go. Okay, there's still a lot of stuff down here. Let's get rid of that. You can sort of see it. Okay, so a little better. Okay, so here's your radius here. Okay, and the tendon inserting on the radius. This over here would be the ulna. Okay, so there's your biceps brachii. Let's take a look at the long head. So it's funny, when you look at it from this angle, the short head originates here. The long head looks shorter, right? That's a bit misleading. So let's get rid of all of this. There we go. All right, so let's get a closer look at this long head of biceps brachii. And again, this is another reminder, because this is one where students tend to do it. Make sure on a test you write long head of biceps brachii, okay? Don't write just biceps, that's incorrect. So the reason it's the long head is because it actually starts way higher up here on the scapula. Okay, so what we're looking at here is there's your humeral head, and this is the glenoid fossa here on the scapula. And just above it, there's a little bony ridge called the supraglenoid tubercle, and that's where the long head of biceps brachii originates. And it's gonna wrap over the head of the humerus, come down, and join together with the short head for the tendon of biceps brachii. Okay, let's get rid of all of these guys and have a look at a few more. So here's your coracobrachialis. Okay, its name tells you it goes from the coracoid process to the brachialis, that's your arm. Okay, so coracoid process of the scapula down to just the upper surface of the humerus. Ooh, didn't mean to zoom in there. There we go. So coracobrachialis. Just inferior to that is your brachialis. Okay, so we're still on the anterior of the arm. So when you remove biceps brachii, all of this stuff is kind of hiding underneath. And we'll put biceps brachii back on in a second so that you can see what everything looks like when it's all together. So there's your brachialis beginning partway down the humerus. Okay, again, originating on the shaft of the humerus. And it's going to go down and insert on the ulna right there. Okay. All right, let's put biceps brachii back on. We have the long head, short head, there we go. Okay, so you can see when biceps brachii is on there, brachialis is sort of poking out a little bit, especially at the more inferior aspect of the arm. So there's your brachialis back there. Coracobrachialis is then up here. Okay, so again, you can see it a little bit underneath short head of biceps brachii. Okay, let's flip around here and look at triceps brachii, which is here. Okay, so lateral head of triceps brachii, long head of triceps brachii, and we'll actually hide those for a second to show you medial head of triceps brachii. Okay, let's put all of those back. Oops. There we go. So let's get a good look here. All right, so your long head of triceps brachii is originating again on the scapula, just like long head of biceps brachii. So this is going to be the infraglenoid tubercle, meaning it's below the glenoid fossa, which is here. Okay, so the long head of triceps brachii is the only one that crosses the shoulder joint. Let's hide that guy. The lateral head and, oh, I took away the medial head. The lateral head and the medial head both originate on the humerus itself, okay? And then all three heads are going to join to form a common tendon, which inserts on the olecranon process of the ulna. Okay, so before we move into the forearm to show you the one last muscle, I'm going to show it here first. So if we go anterior again, oh, have I removed it? I did remove it, darn it. There we go. I want to show you brachioradialis here, and then we'll move into the forearm to see the rest of it, okay? So there's brachioradialis. We included it in this lab because it's very important in elbow flexion, just like brachialis and biceps brachii are. So we wanted to group those together, but brachioradialis does run all the way down the forearm, so we're gonna have to switch screens to see it there. But it begins way up here on the humerus in what's called the supracondylar ridge. Oh, no, okay, that's fine. Okay, so we're getting into the elbow joint here. So this is the more inferior end of the humerus. So supracondylar ridge is kind of just above the elbow joint, okay? And then it's going to come down and run down the forearm. So I'm going to just pause for a second while I open the other one. Okay, so now what I've done is open the forearm, wrist, and hand section in the 3D real time so that we can get a better look at that brachioradialis. So there we go. So this is the only muscle in this lab where you'll have to jump around a little bit. Okay, so just to give you a little bit of orientation, here's your brachialis coming down, your tendon of biceps brachii, and then your brachioradialis. Okay, now let's get rid of connective tissue and ligaments. And let's get rid of all the other muscles, and just look at brachioradialis for now. Okay, so there's your brachioradialis. So we can't see the origin in here, which is why I showed it in the last section. So it's going to come from that supracondylar ridge on the humerus. Okay, so it's actually going to attach kind of just right here. Okay, and then it's going to come down. And you'll notice that this is lateral. This is on your thumb side. There's your thumb, thumbs up. Okay, so this is on your radial side. Okay, so if you're in anatomical position, then this is lateral. So it's going to come down and insert on the styloid process of the radius right there. Okay, now if you want to see where your brachioradialis is on yourself, what you can do is put your upper limb in front of you with your thumb facing up and kind of make a fist as if you're holding a mug or something, okay? So thumb up, holding a mug, and then use your other hand to push down on your thumb and push up to see your brachioradialis kind of pop out, okay? So if you put your left upper limb out in front of you and make a fist, okay, with your thumb up, then put your right hand on top of your left and push down with your right hand and up with your left hand. You'll start to see that the muscle belly of the brachioradialis stick out, so right here, okay? All right, that's it for this week. Good luck, and we will see you in lab.